Have you been diagnosed with carpal tunnel syndrome? Or are you experiencing symptoms that you might describe as numbness, tingling, or occasional pain? That can be anywhere from the thumb, index, and maybe half of this middle finger. Maybe your occupation is a person of data entry or computer programming, so as a result, you're spending a lot of time obviously using your fingers in a very static kind of position for a super long time. The other person could be like musicians, piano players, guitar players, any of those things that could contribute to maybe some irritation to the median nerve kind of in this wrist area. So, but something else I want to talk about, in addition to being diagnosed with carpal tunnel, from an occupational perspective or occupational therapy perspective, we often also think about something called double crush syndrome. So the median nerve is also derived from upper cervical nerves, particularly between C5 and C6. So the fifth cervical nerve and sixth could also contribute to these symptoms. So sometimes when people only focus and isolate on the wrist and hand area, they might not quite get the outcome that they would like to achieve. Or often the symptoms could actually, the primary driver could be the upper cervical spine. So you can work in this area, not quite get the outcome you want, and then once you start to really focus on the origin or the potential cause or driver of carpal tunnel, working on that upper cervical spine, reducing the compression on that nerve tissue. Maybe there's some compression coming from what we call the scalene muscles in through this area, can have a really profound effect. Other things that we have found to be beneficial for carpal tunnel could be, if you happen to be someone who might sleep with your wrists on your side, maybe in a very flexed position, oftentimes not uncommon to go into a hand splint, a dorsal cock-up splint that will not allow your wrist to flex, so you can reduce compression and irritation through this area. We often do the same thing in the cervical spine. We want to make sure that when you wake up in the morning, if you are having a lot of hand, thumb, index finger related symptoms, that when you wake up in the morning, we've helped alleviate that. So good positioning at night in bed with a pillow, maybe a good cervical roll or collar type thing to keep your neck from going into extreme positions can be beneficial. So these are some things that we look at and consider, but again, sometimes as simple as carpal tunnel treatment might appear, oftentimes it can be a little bit more complex, and you got to be thinking of other drivers, like I said, muscular issues in the neck that could be tight, or compression, irritation in C5, C6 nerve tissue coming from the cervical spine.